Go.
Hi, I'm Shao. You're watching Miss Nicole TS.
Hi again and welcome to my channel Nicole TS, and today I will be talking about my hormones, the effect of the hormones and the side effects as well. I have been getting a lot of messages in my inbox about questions regarding the hormones, and that's why this video is for you guys. Just a disclaimer, I am actually self-medicating, so I am not advising everyone to do the same. I'm not advising everyone to do self-medication because it's not good. I know it's very risky for myself, but before I started my hormones 3 years ago, I did a lot of check up on my liver and went to my endocrinologist and had some check up before I started my hormones to make sure that everything is okay. So before you do any self-medication, so please go to your GP or go to an endocrinologist and have some tests if your liver and your organs are still functioning very well. So yeah, don't be so stupid in that. So the hormones that I'm taking are I am actually taking 3 hormones at the moment. One is an anti-androgen hormone, and 2 is the estrogen and a little bit a combination of anti-androgen and estrogen pill. So when I started my hormonal treatment, I started like 3 years ago, and I started in a small amount of dosage first. I did 2 milligrams of oh my goodness, it's Proganova 2 milligrams, and 1 tablet of this Spiritone 100 milligrams. So when I started 3 years ago, I had 1 tablet of this and 1 tablet of this as well, and it lasted for like 6 before I increased my dosage, it was like 6 months before I increased my dosage. And if you will ask me where to buy this, I bought it online in online pharmacy which is based in Europe or something. Yeah, something like that. And again, don't self-medicate especially if you're young. You have to ask your GP's permission first if you can do so, okay? And yeah, when I started my Proganova and when I started my anti-androgen hormone, the first effect that I felt was around my nipples or in my breast part. My breast became sensitive. It is very, very sensitive, and my nipples are very, very painful, and that I don't like. Well, yeah, you can in your first 6 months of hormone HRT, you could actually feel like your breasts are starting to grow a bit, but it's not that really big that you can have with a cup A and all. But it's just like you can feel it because you can actually feel a little. It's like a lump. It's like a lump on your below your nipple, and it's very painful. So yeah, that's one effect that I experienced. I had a tiny breast growing on, and another thing is my skin became soft, and I think I looked more feminine when I started my hormone. After I started my hormones 6 months after I started my hormones, I looked more feminine because estrogen can help on feminization. It distribute fats in the appropriate part of your body, and it will give you shape. It will, you know, give you a nice figure, like a woman's figure. And yeah, I think it happened to me. One thing that I really notice is because I am a very athletic person, I play badminton a lot, and this arm is always used not in doing something, you know, like that, but in playing badminton. And I have like a vein here, like an obvious vein. But when I started hormones, you know, my skin became soft, and that obvious vein, which makes it like more of like a masculine arm, it's just, you know, it's gone. I can still see that, but it's no longer visible when you see it like that. Another thing is your hair growth in your upper lip and lower lip and in your body. If you're taking hormones, your hair growth would grow slowly, and if you like shave it and it would grow back, the hair is not that thick and black compared before, because, you know, the estrogen hormones help, you know, stop the production of hair, and makes you more feminine. And I still do my shaving like every 2 to 3 days, because I can still feel it actually, and I don't want to go out with that mustache or beard. So I want to look feminine every day, but I usually go out with a makeup, so I don't really mind if people would see me as a transsexual, or if they would see me as a girl, or like, that would be good. Yeah, I am happy being me. Well, anyways, going back, after a year of taking hormones, I was introduced by my friend, or no, I asked my friend what hormone she was taking, because she's been taking hormones for quite some time now. And she said she's taking Diane 35 there, and it's this one with the beautiful girl on the cover. This Diane pill has 28 tablets in one box, and this is taken orally, and it contains cyproterone acetate and plus ethinyl lestradiol. Yeah, something like that. They said that if you're taking Diane, your sex life would really change, your libido would go down, and, you know, taking hormones makes you weak. It's true. I would say it's true in my experience. When I was taking hormones, I was like weak most of the time. I can't even open 1 liter of Coke by twisting the cap. I can't, because I don't know. I try, but I can't. Before I can do when I was when I'm not taking any hormones, but yeah, after I took hormones, you know, my energy went down, my strength went down, everything just went down, libido and all went down. And yeah, I started taking Diane April of 2013. Yeah, but I was just trying it, like I'm taking it every other day. So I was taking Spiridone 100 grams, Procainova 2 milligrams, and Diane, 1 Diane tablet a day. So I'm taking 3 hormones a day. Yeah, it's true. To look and to be feminine needs this help. Hormones. It's not easy, I know. It's not. It will not happen immediately, so you have to be patient to do their magic to your body. believe me, it's really worth it. Yeah, and if you saw my before and after picture or video clips of my pictures before and after, you would really, see the big difference of my face before compared now. So, don't overdose as well. Just take the hormones moderately. Don't think that, I'll be taking 5 Pargainova, 5 Spiritone, and 6 Diane to make my transition quicker. No, it's not like that. You have to do it in moderation. You have to start in a small amount and then eventually, increase your dosage after like a year, 6 months. It depends on the GP. But at the moment, because I am doing self-medication, I asked my GP to refer me in a gender identity clinic, which is in London, which they will assess me and provide my hormones in the right dosage and in the right amount and the right hormones for me. And I won't be advising, or I won't recommend to, I won't say this to everybody to do self-medication because it's not good. I mean, it's very risky. If you read some articles in online, you would see the not so good about hormones. Now, the not so good about hormones that I experience, first, that I really don't like is having mood swings. Yes, when I started my hormones, after a month or 2 months, or maybe it's just psychological for me, I had like sudden change of mood from from happy to sad, from sad to happy, and most of the time I'm sad and I'm very weak. I don't know if that's maybe that's the effect of hormones, because it changes your hormones inside your body. It lowers your testosterone level, which makes you more strong, makes you more like alive and all that, especially if your body was used to have like loads of testosterone and suddenly you will suppress it. It really affect you, your strength, your mood in general. So I don't like it. Feels like I have a mood disorder problem. I was a bit paranoid that I have that problem, but I've read it online. It's just normal. It's one of the side effects. And second thing is, I don't like my nipples because it's very painful. I can't do things that I want to do with that. I couldn't use it properly, even though it wasn't this big. But still, I really want to use it, but I can't because it's very painful. That's one thing that you should be ready to experience when you're starting taking hormones. And another thing is, you won't have much energy. You'll be more. I mean, in my case, I was a little bit weaker when I started my hormones. I don't have the strength anymore. And last November I actually had my testosterone level test, because I need to do that for my Badminton England requirement for me to play as a woman in the Badminton England. I checked my hormones, testosterone level, and I was surprised. It was actually 0.1 nanomoles per liter. That was 0.1 nmol per liter. And my doctor said the hormones are doing great job for me because it suppressed my testosterone level, and it helped the hormones do its wonder in my body. So just for the recap, at the moment I'm taking one Spiritone 100 milligrams a day, one tablet of Diane a day, and one Progynova 2 milligrams a day. So I'm actually taking 3 tablets every day, but sometimes I forgot, and if I forgot to take my hormones, I don't normally overdose or double the dosage the following day, but no, I just like let it pass because it won't do good if you're doing it overdosing your hormones. I hope you learned something from my experiences, and if you have like comments, or if you have something to share about what hormones what hormones are you taking, what bad experiences or bad effects that you felt, please comment it below so everyone can read it and everyone can share their stories as well. And this would be a good time to share our experiences, and we can learn from each other. So yeah, please comment it below, and please, for those people who haven't subscribed yet, click subscribe as well, because I will be doing a lot of videos about transition and about from male to female transitioning. So yeah, click subscribe, and I will be seeing you again in the next video. Bye!